Dr. Nazari, can you shed some light on, the importance of the first baby teeth, which lasts still, 6, 7, 8 years, whatever, and then the permanent ones. There sometimes is a conception out there that, well, it's the baby teeth and they're going to be gone, and why work on them? Why replace them? Why put the child through the danger of, or the hassle of going to a dentist? Maybe the child doesn't like to, and throws a fit, so kind of, okay, let it happen. A tooth is missing, a tooth is a little blackened, there's a little cavity, it doesn't matter, comes out in a year anyway. What's the big deal? Is it a big deal? Should parents be concerned about it? Are there consequences not taking care of the baby teeth? Yes or no?
Well, unfortunately, the misconception is there because of the lack of proper dental education. The baby teeth are not in the mouth just for only 6 years. They are in the mouth up to age 12. Many of the teeth, especially the teeth in the back, up to age 12, the kids have the teenagers have their baby teeth. Now, just like the adult, we need to have teeth to chew for proper diet and nutrition. Kids the same way, they need to have proper diet and proper nutrition by eating fruits, vegetables, and you need to have teeth to chew on. If you don't have the baby teeth, how are you going to chew on the food? So that's a misconception. They need to have their teeth in order to chew. Also, the baby teeth provide spaces for the permanent teeth to erupt, because permanent teeth, if everything is ideal, the permanent teeth are sitting below the respective baby teeth. So when they lose the baby teeth, naturally the permanent teeth is about to erupt, to come to take its place. If you lose a baby tooth prematurely, then there is going to be what we call the shifting of the teeth that would end up needing braces and some other procedures that might be, complicate the eruption of the teeth, and also the more expenses for the parents.
So basically, if you not look at how the baby teeth are growing or falling out, and then kind of like help the next set of teeth, which is the permanent teeth, to grow properly, just the way you might be, if you grow a tree or something, you might be taking away another tree or weed so that tree can grow the way it's supposed to grow. As you see it springing off, you have to take care of the teeth, and if not, you're risking that the orthodontic work, the straightening out the teeth, may become much larger than it otherwise would. Is that what you're saying?
Yes, sir.
And that, of course, would be more expensive and usually adds in lengths of time the child needs to wear the braces, which, even though sometimes it's hip to wear the braces, once they have them on it, they're pretty glad to get rid of them, don't they?
Oh, definitely. They can't wait to get rid of braces.
Sure. All right. So good. Well, all right. Again, we should be taking care of the first teeth. And I don't know, but I have seen little kids, and my wife and me, we don't have children, so I wouldn't know. But I've seen children, and we are around lots of children. I've seen children being rather self-conscious. It's no different than an 18 or 20-year-old girl or boy. When they're 4, 5, and 6, and they're around kids, and the kids tend to laugh at a child with a no tooth or with a brown tooth, basically looking different. They may not put the aesthetic feeling to it the way a grown-up girl would, but it's a different, I'm different type of thing, and they don't like it. Is that true? Have you observed that also?
Yes, I agree with you definitely. Emotional age of any person is different from their calendar age. Some patients some people are emotionally precocious than the other people. So they would, even we have kids at age 8 or 9, they come and they complain about the color of their teeth. So they want to get their teeth wider. So these days, it can have emotional effect on patients. Definitely, I agree with you.
Right. Yeah, you just don't want to.
These days, people are more self-aware than when we were growing up.
Yeah. And, and I can only see, I mean, I remember my parents, growing up in Europe, and they paid attention to that we dressed nicely. There was a Saturday dress, there was a church dress, there was all kinds of different dresses, and you just were dressed properly, so to say, which doesn't mean super expensive, surely not when I grew up with my parents, but you were dressed properly, and it somehow sticks with you. So if a young child starts having bad teeth, bad looking, kids nick them and make fun of them, and it becomes like normal, and more likely for them to become slappy all over their life and not to put all that much attention on their teeth, because as a young it was like, oh, it doesn't matter, it's just your mouth. I can see that.
Yes, we see that every day, unfortunately.
Right.
Every day.
Right, and we definitely want to avoid the children being picked up by somebody else, if we can. I mean, there's enough picking going on no matter what as you grow up. We know that, but why don't take away some of the obvious factors which we as parents can take away? And as I said, it's a thing I don't have. We don't have children, but I can see where that comes in. Anyway, Dr. Nazari, thanks for letting us know and shedding some light on this issue. Very important issue, I think. Bye-bye.
Thanks, bye.